Pittsburgh sells America bridges, rivers, sports loyalty, hospital power, tech ambition, and the proud rebirth of a steel city that survived collapse. But beneath those bridges, beside the river trails, inside tents, abandoned buildings, and cold concrete shadows, another Pittsburgh is still rusting in silence, where people sleep outside while addiction, poverty, and housing failure grind them down night after night. This is Pittsburgh in 2026, a city of three rivers, yellow bridges, steep hills, old mill towns, football devotion, world-class hospitals, universities, robotics labs, and neighborhoods that still carry the memory of steel. To tourists, Pittsburgh can look like a comeback story. The skyline rises where the Allegheny and Monongahela meet. The stadiums glow, the inclines climb the hills. The old industrial city has reinvented itself as a center of medicine, education, technology, and culture, but for people living without housing, the comeback feels incomplete. There are tents along river corridors, people sleeping under bridges, camps near trails, people in abandoned buildings, men and women carrying everything they own through rain, snow, and river wind. Some are trapped in addiction, some are mentally ill, some are older, some are newly homeless, some were priced out, some were evicted, some were failed by systems that offered help too slowly or not at all. Pittsburgh is not facing homelessness in the same visible scale as Los Angeles or San Francisco. It does not always look like an endless tent city stretching for blocks. Its crisis can be smaller, colder, quieter, and more hidden, but hidden does not mean solved. A person sleeping under a Pittsburgh bridge is not suffering less because the city's skyline looks beautiful above them. This is a city where progress and pain live together. Allegheny County officials point to signs of stabilization. Outreach has expanded. Shelter systems are active. Encampment closures have sometimes been paired with real housing offers. Overdose deaths have fallen sharply from the worst years. Housing programs have moved people indoors. But the crisis is still there. And the central question remains, in a city that already survived one economic collapse, who gets left behind during the recovery? This is the Pittsburgh homeless crisis of 2026. One, the numbers behind the bridges. The 2026 point in time count in Allegheny County estimated that 1,108 people were experiencing homelessness on a single night. Of those, 930 were sheltered and 178 were unsheltered. Those numbers show something important. Most people counted were indoors, in shelters, or temporary housing. That means Pittsburgh and Allegheny County have a stronger shelter and service infrastructure than many places where the unsheltered population dominates the count. It also means outreach, shelter placement, and housing programs are doing real work. But the number 178 still matters. Those 178 people were outside or in places not meant for human habitation. They were not in stable homes. They were not behind locked doors. They were in tents, abandoned buildings, temporary shelters, vehicles, or other unsafe spaces. And county officials themselves said the 2026 count should be treated as a new baseline because the methodology changed, making year-to-year comparisons difficult. That detail's important. In 2025, Allegheny County's count showed a sharp increase in unsheltered homelessness, including a 66% rise in the January count compared with 2024. But officials later said the methods used in previous counts made interpretation difficult. They repeated the count in March 2025 with clearer documentation and found a smaller but still significant increase. This means the numbers tell two stories at once. First, homelessness is real and persistent. Second, measuring unsheltered homelessness is difficult, especially in a city where people may sleep in woods, under bridges, in abandoned buildings, near river trails, or in places outreach workers cannot easily see. A count can miss someone in a tent tucked behind brush. It can miss someone who moves before volunteers arrive. It can miss someone in an abandoned building. It can miss someone sleeping in a car, a basement, a couch, or a temporary arrangement that does not fit official definitions. So when Pittsburgh sees 1,108 people in the official count, the deeper reality is larger than the number. The count is not the crisis itself. It is only one night when the crisis allowed itself to be measured. Two, river camps and life beneath the bridges. Pittsburgh's rivers are part of its identity. The Allegheny, the Monongahela, the Ohio, the bridges crossing them, the trails beside them, the skyline reflected in the water, the riverfront restaurants, stadium views, bike paths, and redevelopment projects that tell the story of a city trying to turn its industrial past into a modern future. But riverfront beauty has another side. Along trails and under bridges, people without housing have built survival spaces. Some camps are visible, others are hidden. Some are temporary. Others stay long enough to form small communities. Tents appear near paths where joggers, cyclists, and tourists pass. Blankets, carts, propane tanks, tarps, and plastic bins become the architecture of survival. To housed residents, these camps can feel like a sign that the city has lost control. They worry about fires, trash, drug use, public safety, blocked trails, theft, sanitation, and environmental damage along river corridors. Those concerns are real. Encampments are not safe housing. They can be dangerous for residents nearby and dangerous for the people living inside them. But for people living there, the camp may be the last place where they have any control. A tent under a bridge is not dignity, but it may offer shade, some cover from rain, a place to keep belongings, and a small community of people who know one another. A river trail camp may be unsafe, but it may still feel safer than a shelter where someone has been robbed, assaulted, separated from a partner, forced to give up a pet, or unable to keep belongings. This is the contradiction Pittsburgh keeps facing. A camp is not a solution, but removing a camp without housing is not a solution either. County materials show that Allegheny County now tracks visible tent encampments in downtown Pittsburgh and riverfront trails through a weekly dashboard. That means the camps are not rumors. They are part of the official response landscape. They are monitored, mapped, debated, and managed. But mapping a camp is not the same as ending homelessness. The only real measure is what happens after the tent comes down. 3. The Steel City Shadow. Pittsburgh's homelessness crisis cannot be understood without understanding the city's past. This was once the Steel City in the most literal sense. The mills shaped the economy, the neighborhoods, the air, the labor movement, the rivers, the family structure, and the identity of the region. For generations, steelwork gave families a pathway into the middle class, even if that pathway was shaped by racial inequality, dangerous labor, and hard lives. Then the steel economy collapsed. Beginning in the late 1970s and accelerating through the 1980s, Pittsburgh and surrounding communities lost tens of thousands of manufacturing jobs. Some estimates describe around 95,000 manufacturing jobs lost between 1,980 and 1,983. Other accounts describe even deeper regional losses across the decade. Mills closed, families left, towns hollowed out, neighborhoods lost population, tax base, and stability. Pittsburgh eventually reinvented itself. Universities grew, hospitals expanded, technology companies arrived. Robotics became part of the city's new brand. Healthcare and education became economic anchors. Tourists began to see Pittsburgh as cool, affordable, scenic, resilient, and unexpectedly beautiful. But reinvention does not reach everyone equally. Some people were carried into the new economy, others were left with the old wounds. The steel jobs that once supported families did not come back in the same form. The new jobs often required credentials, networks, mobility, education, or specialized skills. Neighborhoods with long histories of disinvestment did not all recover at the same speed. Some former mill communities still carry vacancy, poverty, addiction, and aging housing stock. This matters because homelessness is not only a present-day failure, it is also history showing up in the body of the city. A man sleeping under a bridge may be dealing with addiction today, but behind him may be decades of job loss, family instability, neighborhood decline, poor health, incarceration, trauma, and housing insecurity. A woman in shelter may have lost housing this year, but the neighborhood she came from may have been losing resources for generations. The Steel City survived collapse, but survival is not the same as repair. 4. Addiction under the bridges. Pittsburgh's homelessness crisis is deeply connected to addiction, though addiction does not explain every person without housing. Allegheny County has seen a dramatic drop in fatal overdoses since the peak years. Fatal overdoses fell from 665 inches 2023 to 432 inches 2024, with preliminary 2025 numbers showing an even lower count. That decline is important. It means naloxone, harm reduction, treatment access, changing drug supply conditions, public health work, and community response may be saving lives. But lower deaths do not mean the danger is gone. The unregulated drug supply remains unpredictable. Fentanyl has declined in some testing samples, according to local reporting, but street drugs are still dangerous. Some drugs expected to contain fentanyl may contain little or none, while another batch can contain enough to kill. Other substances, including strong sedatives and tranquilizers, can create brutal withdrawal, confusion, injuries, and medical crises. For people experiencing homelessness, the risk is multiplied. A person may use alone under a bridge. A person may use in a tent, a bathroom, an abandoned building, a trail camp, or a stairwell where no one arrives in time. A person may not know what is in the supply. A person may have no safe place to recover. A person may be discharged from a hospital back into homelessness, carrying wounds, withdrawal, and no stable plan. Addiction and homelessness feed each other. Some people lose housing because addiction takes over. Others begin using after homelessness breaks down their body and mind. Some carry untreated trauma. Some have mental illness. Some have chronic pain. Some use because withdrawal feels like death. Some use because the street is cold, dangerous, and humiliating. Some are trying to numb grief they never had the resources to process. People ask, why don't they just stop? But stopping requires stability. How does someone detox without a bed? How does someone attend treatment without transportation? How does someone keep medication safe without a room? How does someone answer a caseworker's call when their phone is dead? How does someone stay sober while sleeping beside the same fear, hunger, and isolation that push them toward drugs? Recovery needs housing. It needs trust. It needs medical care. It needs mental health support. It needs time. Without those things, the bridge becomes both shelter and trap. 5. Housing pressure in an affordable city. Pittsburgh is often described as affordable compared with coastal cities. Compared with New York, Boston, Los Angeles, Seattle, or San Francisco, that may be true. But affordability is not measured only against other cities. It is measured against local income, local rent, local disability checks, local wages, local savings, and the actual housing available to people at the lowest income levels. Allegheny County says almost 30% of households spend more than 30% of their income on housing costs. That makes it harder to afford food, transportation, health care, medicine, and other necessities. Public Source reported that local estimates show a deficit of more than 11,000 affordable units for residents at the lowest income levels in Pittsburgh. That is the wound behind the crisis. A city can be affordable to a software engineer and unaffordable to a low-income renter. A home can be cheap compared with Boston and still impossible for someone living on disability. A neighborhood can look undervalued to investors and still be too expensive for families already there. A rent increase that seems modest to a professional can be catastrophic to a household with no savings. This is how homelessness begins. Rent rises, utilities rise, food rises, medicine rises, a car breaks, hours get cut, a family member gets sick, A landlord sells. A lease is not renewed. A court notice arrives. A voucher cannot find a unit. A shelter bed is full. A friend's couch is no longer available. Then a person is outside. Pittsburgh's housing crisis is not always about explosive rent levels. Sometimes it is about mismatch. The housing that exists is not always safe, accessible, affordable, or available to those who need it most. Some units are old and deteriorating. Some landlords refuse vouchers. Some households face eviction records. Some people need supportive housing, not just any apartment. The market may look affordable on paper, but people sleep outside in real life. 6. Abandoned buildings and unsafe shelter. Allegheny County's 2026 count noted that abandoned houses and buildings, along with tents and temporary shelters, were among the most common unsheltered sleeping locations. That detail says a lot about Pittsburgh. This is a city with old housing stock, vacant properties, industrial remnants, and neighborhoods where abandoned structures still exist beside occupied homes. For someone outside, a vacant building can look like danger and opportunity at the same time. It may have walls, it may block the wind, it may hide a person from harassment, it may feel safer than open concrete, but abandoned buildings are dangerous. Floors collapse, fires start, mold spreads, broken glass cuts, roofs leak. Drug use happens out of sight. Violence can happen without witnesses. A person can overdose and not be found. Winter can still reach through broken windows. No one should have to choose between a tent and an abandoned building. But people make that choice when the system does not offer enough safe options. This is the hidden side of Pittsburgh's homelessness crisis. Not every person is visible under a bridge. Some are inside buildings nobody uses. Some are in abandoned structures near places drivers do not see. Some are sleeping in places that are dangerous precisely because they are hidden. That makes outreach harder. It makes counting harder. It makes saving lives harder. And it reveals a brutal contradiction. The city has empty structures and people without homes, but the structures are often too unsafe, too legally complicated, too expensive to repair, or too disconnected from housing systems to become immediate shelter. An empty building is not automatically a home, but to someone freezing outside, it is hard not to wonder why every wall remains locked. 7. Encampment closures and the promise of credible offers. Pittsburgh has taken a somewhat different approach from many cities in the post-Grants Pass era. After the Supreme Court gave cities more authority to enforce camping bans against people sleeping outside, many places moved toward more aggressive sweeps. Some cities have used citations, arrests, and repeated clearings as primary tools. Pittsburgh and Allegheny County, under pressure from advocates and community groups, have tried in some cases to pair encampment closures with credible offers of long-term housing. One widely discussed example was the closure of the Eliza Furnace Trail encampment, sometimes known as the Jail Trail, because of its proximity to the Allegheny County Jail. Reporting said that by the time the camp was closed, residents had already moved into transitional or permanent housing, and what remained was mainly trash. That matters, because there is a huge difference between closing a camp after people are housed and clearing a camp while people are still inside it with nowhere to go. One approach says, "We will not leave you here, but we will offer a real exit." The other says, "You cannot stay here, but we do not know where you will sleep tonight." Pittsburgh's more housing-centered approach has drawn praise from some advocates, but it is also politically fragile. Residents frustrated by visible camps may demand faster action. Business owners may want clearings without delay. Politicians may feel pressure to show visible order. Advocates may worry that even good policies can collapse under election pressure, funding limits, or public anger. The future of this approach is not guaranteed, and that is what makes it important. If Pittsburgh can prove that encampments can be closed by housing people rather than simply displacing them, it could offer a model. But if the model fails because there are not enough units, not enough funding, not enough political patience, or not enough treatment capacity, the city could slide back toward the same cycle seen elsewhere. Clear the camp, People move. Clear the next camp. People move again. Visibility changes. Homelessness remains. 8. Families and hidden homelessness. Not everyone experiencing homelessness in Pittsburgh is under a bridge. Some are in shelters. Some are doubled up with relatives. Some are sleeping in cars. Some are moving through motel rooms. Some are young people couch surfing. Some are families waiting for a safe unit. Some are seniors trying to stretch fixed incomes in aging apartments. Some are people fleeing domestic violence. Some are discharged from medical or behavioral health systems into unstable housing. Family homelessness is often hidden because parents try to protect children from shame. A mother may avoid telling school officials the whole truth. A father may work while sleeping in a vehicle. A grandmother may take in family until the apartment becomes overcrowded. A teenager may pretend to friends that everything is normal. A child may do homework in a shelter room or in the back seat of a car. The public sees tents because tents are visible. But hidden homelessness is often where the crisis begins. A family doubled up today may become a shelter family next month. A worker sleeping in a car today may become unsheltered after the vehicle breaks down. A person staying in an unsafe relationship today may become homeless after leaving for survival. A senior skipping medicine to pay rent may fall into crisis after one hospitalization. Homelessness is not always a sudden fall. Sometimes it is a slow slide. And in a city with old housing, rising costs, limited, deeply affordable units, and complicated systems, the slide can be hard to stop once it begins. 9. Rumors, distrust, and the politics of riverfront poverty. Whenever homelessness remains visible in a city trying to sell revival, rumors grow. In Pittsburgh, some residents ask whether riverfront redevelopment receives more urgency than housing for the poor. Some believe camps are cleared faster when trails, stadium areas, tourists, or high-value neighborhoods are affected. Others say the city is trying to balance public safety and humane outreach under difficult conditions. Some claim homelessness has become an industry, with money moving through nonprofits, contracts, consultants, developers, landlords, shelters, outreach programs, and political offices, while people remain outside. There is no verified proof of one hidden conspiracy controlling homelessness in Pittsburgh, but the suspicion itself is part of the crisis. People see tents under bridges and ask where the money went. They see affordable housing debates drag on and ask who benefits from delay. They see new developments rise and ask why low-income units remain scarce. They see river trails cleaned and wonder whether the goal was housing or image. They see overdose deaths decline and ask why addiction still dominates street life. Not every rumor is true, but the questions behind them deserve answers. How many people moved from encampments into housing? How many stayed housed? How many were offered shelter but refused because the shelter did not fit their needs? How many died before help reached them? How much money goes to permanent housing versus temporary management? How many affordable units are truly affordable to the lowest income residents? How many people are turned away because there is no appropriate place for them? Transparency matters because trust is fragile. Without clear outcomes, even good policy begins to look like performance. 10. What Pittsburgh must confront. Pittsburgh has strengths many cities would envy. It has active outreach, it has shelters, it has a county human services system that tracks data, it has organizations working on harm reduction, housing, health care, and street level survival. It has hospitals and universities. It has public attention. It has examples of encampments being closed after people were moved into housing. It has an official county housing plan focused on supply, tenant protections, home repair, eviction prevention, and mental health housing. But the crisis is larger than good intentions. Pittsburgh needs more deeply affordable housing, more permanent supportive housing, more eviction prevention, more behavioral health housing, more low barrier shelter, more harm reduction, more recovery housing, more mobile medical care, more housing options for people with pets, partners, belongings, trauma, addiction, and mental illness, more transparency about encampment outcomes, more protection for families before they lose shelter, more ways to turn old buildings and vacant land into safe homes without displacing the poor. Most of all, Pittsburgh needs to make sure its comeback does not become a story that excludes the people still suffering beneath it. A city can reinvent itself and still carry old wounds. A skyline can shine and still cast shadows. A bridge can connect neighborhoods while people sleep underneath it. A river trail can be beautiful and still become a place where someone's life is falling apart. The measure of Pittsburgh's success is not only whether downtown looks cleaner, it is not only whether tourists feel safe on the trail, it is not only whether a camp disappears from view. The measure is whether the person who lived there is housed, treated, stable, and alive 6 months later. Final message. As night falls over Pittsburgh, the city becomes two places at once. One, Pittsburgh glows across the rivers. The bridges shine yellow. Stadium lights reflect off the water. The skyline rises from the point. Hospitals hum on the hills. Restaurants fill. The city tells the world it has survived steel, smoke, collapse, and reinvention. The other Pittsburgh is beneath that beauty. Someone is sleeping under a bridge. Someone is hiding in an abandoned building. Someone is using drugs because the pain feels too loud. Someone is waiting for outreach. Someone is trying to stay warm near a river trail. Someone is carrying everything they own past a city that keeps moving. Someone is wondering whether the comeback was ever meant for them. These people are not statistics. They are not obstacles to redevelopment. They are not stains on the riverfront. They are Pittsburgh. They are workers, parents, veterans, survivors, young people, elders, people with addiction, people with illness, people with trauma, and people still holding on inside a city that knows better than most what collapse can do to a human life. The Steel City should understand broken systems. It should understand what happens when work disappears, neighborhoods empty, and families are left to rebuild from ruins. And because Pittsburgh understands collapse, it should also understand repair. If this story moved you, tell us in the comments, what should Pittsburgh do first? Build more deeply affordable housing, expand permanent supportive housing, increase addiction treatment, protect riverfront camps from harmful sweeps, unless housing is ready, invest in mental health, housing, or demand more transparency from every dollar spent. If stories like this matter to you, please like this video, share your thoughts, and subscribe for more human-centered documentaries about the lives America too often overlooks. May every person sleeping under a Pittsburgh bridge find safety tonight. May every person trapped in addiction find one more chance to live. May every family close to homelessness find help before shelter becomes the only option. May every outreach worker have the resources they need. May every empty building become either a healed part of the neighborhood or a safe home, not another hiding place for suffering. And may Pittsburgh be measured not only by its bridges, its rivers, its hospitals, its teams, or its comeback story, but by how deeply it protects the people still living in the shadows beneath them.